Hi, I'm Dr. Adeton Musa,
Hi, I'm Dr. Hussein Musa,
and this is Healing Talks with Kingdom Docs.
and we are going to continue our discussion on our healthcare system and some of its limitations.
hmm
So, right now, we work in a healthcare system that is limited on how much time a physician can spend with a patient, and there's barriers to care through insurance and also conflicting interests in terms of profit driven medicine. Now, a, an alternative model is the direct care model, where a physician can work directly with the patient without the interference of insurance or any other barriers to improve access to care and also to improve the amount of time that the physician can spend with the patient. And we're talking about this so that patients have time with doctors, and we believe that healing with and patients and all of their illnesses that they may present, they can do better if they have time with their physician and access with their physician.
Yeah, I really think that increased time also increases the quality of care with the patient. It ushers in an excellent spirit when dealing with the patient. You're not rushed, you don't feel overworked or tired or burned out.
Yes. Now, in this direct care model, we've been mentioning it a lot. The direct care allows us to work directly with the patient. And typically, in a direct care model, the practice does not take traditional healthcare insurance. They actually take payment directly from the patient in the form of a monthly subscription fee.
So this is really going back to the old-fashioned way of interacting with patients. No more complications as far as middlemen, and it really simplifies, what we do and how we get compensated.
I know, and this is a challenge because a lot of people have health insurance, and the biggest challenge is, why should I pay for care if I have health insurance?
Yeah.
Now, what I'm going to discuss is that health insurance doesn't always mean you have access to care.
That's true.
And if you've ever been to the hospital despite your health insurance, you realize that you get a bill, and the bigger the problem, the bigger the bill.
Yeah, for sure. I can even speak to that personally. Being a patient myself, I thought I had insurance, and I did. I think we had pretty good insurance, but bill after bill after bill after surprise bill would come months after.
Yes. And my wife had a baby, like a lot of people do.
Yeah.
It happens, and you may have to have a procedure to have your baby. And one way to deliver, let's just say, is more expensive than another way to deliver.
Absolutely.
And one of those limitations is that if you're paying for health insurance and you're still paying all these extra bills to receive care, it begs the question, what are you paying for?
Right.
And that's why I believe the direct care model, especially for different fields like neurology, pain medicine, primary care, where you're going to have an ongoing relationship with your doctor, wouldn't it be an amazing interaction if you have the same doctor that you can see on a monthly or even weekly basis, depending on your schedule, and this doctor knows you, they knows your history, they are able to provide you the care that you need. You're going to start seeing improvement in your health.
Absolutely. I do think that it will improve outcomes in health, not only because of the time with the patient, quality of care that we're delivering to the patients, but it helps the patient become accountable to their own health plan. They have skin in the game. They are invested. And so it's not something where the patient is just kind of this passenger with no say or power in their management plan.
I think direct care allows you to really see how much your health is worth.
Yes.
And we'll talk more about this next time on Healing Talks with the Kingdom Docs.
Bye-bye.
Please visit us at kingdomdocs.com.